Thank you very much, President, and as well as the Chancellor and dear colleagues. It is really my pleasure and honor to give a brief talk on this COVID-19 workshop. As we all know that emerging infectious diseases threaten global health, economic growth, and sustainable development significantly. The catastrophic COVID-19 pandemic originated from Wuhan in December 2019 is a good example. It was reported by U.S. National Bureau of Economic Research that the lower the COVID-19 mortality rate, the lower the GDP loss in 2020.
Oops. Oops, we lost.
Okay.
We lost the
screen.
Okay, good.
Oh, excuse me. And as you can see here, this slide that's on the horizontal axis is the COVID days per million people, and the horizontal axis is the GDP loss. As you can see, among these 40 countries, the lower the COVID days per million people, the lower the GDP loss. And as you can see, that the COVID-19 pandemic has changed the expectation of how fast the scientific breakthrough can be applied to pandemic containment. Just as mentioned by our President Von Braun, the rapid identification of SARS-CoV-2 as the cause of COVID-19 and publication of its gene sequence from China has facilitated the rapid development of diagnostic, antivirals, and vaccines. In digital technology, artificial intelligence, Internet of Things, machine learning, and big data analysis have been widely used for the implementation of non-pharmaceutical interventions, NPIs, including the border control and quarantine, contact tracing and testing, home isolation, and digital fencing, equal distribution of personal protection equipment, PPE, and social distancing. And innovative platforms have been used to develop pharmaceuticals, including antigen and antibody-based diagnostic, messenger RNA adenovirus, and protein subunit vaccine, as well as therapeutics through injection or oral intake. However, the origin of SARS-CoV-2 and the infection source of the first cases remain unknown. And the clarification of the origins of the SARS-CoV-2 and COVID-19 could help prevent future pandemic. There are several theories of how the virus emerges have been hypothesized, ranging from natural zoonotic spillover to those associated with laboratory work. Scientists need to be able to evaluate these all viable hypotheses with credible data. Data accessibility, transparency, and full cooperation from China will be essential for a proper and thorough investigation. All investigations should be guided by scientific principles, including the reliance on verifiable data, reproducibility, objectivity, transparency, peer review, international collaboration, minimizing conflict of interest, finding based on evidence, and clarity regarding uncertainties. And many countries have used this big data analysis and visualization of real-time pandemic situation to let the people know the current situation. And there are 5 important elements, including the automation, real-time, transparency, visualization, and public-private partnership. There are 2 phases of COVID-19 containment. First one is the interruption of viral transmission through non-pharmaceutical interventions, NPI, before November 2020, when EUA of vaccine was issued. NPI includes a wide spectrum of measures, including the border control, home or hotel quarantine, and contact tracing, testing, and isolation, wearing masks, washing hands, social distancing, avoidance of gathering, crowd control, and so forth. And phase 2 is the acceleration of immunization coverage plus NPI. As you can see on this slide, published by our work in data, this is the COVID-19 stringency index. And as you can see here, that different countries have different stringency index. For instance, Taiwan keep very low stringency index until mid-May of 2021. Japan also keep a low stringent index all over this from 2020 to 2021. And other countries, they have a very high score of a stringent index. In other words, many countries has locked down the city, closed the school, or closed the workplace, and so forth. However, there's this kind of NPI basically will result in a wide range of this cumulative confirmed COVID-19 case per million people. As you can see here, the United States had the highest cumulative confirmed COVID-19 case per million people, followed by the United Kingdom, and Taiwan, Hong Kong, Japan have a lowest cumulative confirmed cases per million people. With regard to this cumulative mortality of COVID-19, as you can see here, that the United States, United Kingdom, and European countries have higher mortality compared with countries in Asia. And different regions and different countries adopted different kind of non-pharmaceutical intervention. And I think this most important thing is to exercise a precision intervention using this digital technology and artificial intelligence for prudent surveillance, and as well as the rapid announcement of travel warning, stringent border control, and intensive and comprehensive contact tracing and testing, as well as mandatory home isolation and quarantine. And in many countries, they use this QR code web form to do this border control, and they also set up tracking system of disease control, and e-fence system were applied to do this quarantine monitoring, and Livebot system was used to provide care services to the quarantined people. And electronic fencing system for home-based isolation and quarantine have been also set up. If someone live out of this fencing area, then a short message will send to local health authority, and the officers will visit the quarantine people, and they will impose a fine if the people left the fence, the digital fence. And of course, it's very difficult to ask people to stay at the quarantine place for 14 days, and care and support services are necessary. And even there's an epidemic compensations are required too. And as you can see, in some countries, they use the tracking and hot zone identification technology. I try to get this footprint of this each confirmed cases. For instance, this is a track of the specific confirmed cases, and we can identify the hot zone here, and then we can send the cell broadcast to persons who visit the hot zone during a specific period of time. For instance, when there was a tourist from the Diamond Princess in Taiwan, these are the hot zone identified among the tourists from the Diamond Princess cruise, and then we announced this kind of cell broadcast to more than 600,000 people in Taiwan to warn them to taking care of their health condition. Of course, this kind of contact information-based measure should follow a very important guideline. For instance, we have clearly informed the people what we are going to do, and all the data will keep only for 20 days, and the data were only for purpose of prevention of this epidemic, and the contact investigation is only limited to this personal contact and nothing in detail. And there's a responsibility of the medical officer to protect the privacy as well as the cybersecurity. And this is a kind of trade-off between the privacy protection and the disease control. So we should use this low precision method to detect each individual's track rather than use a high precision GPS. And also it has to comply with the law and also to protect this human rights as well as this personal privacy, and have to fit in this principle of proportionality. And the promotion of the efficacy of NPI through education is very important. The efficacy of NPI on the prevention of pandemic depends on people's compliance to the regulation and guideline. Behavioral scientists and health educators may play an important role to promote health knowledge, attitude, and practice of people. And a virtuous cycle of good governance and good citizenship resulted in the good COVID-19 containment. And from the very beginning of the pandemic, many governments have ensured the public has the open access to COVID-19 information, and many countries held press briefing since January 2020 to generate accurate news across a broad spectrum of media outlets. Their health authority quickly earned the trust of the public. Public trust has a stabilizing influence on society, encouraging citizens to follow governmental guidelines and guidance, and making the public less vulnerable to disinformation assault. And transparency, public trust, and solidarity are natural products of vibrant democracy. For example, in Taiwan, we have home isolated and home quarantined more than 750,000 people, and only 2,000 of them, less than 2,000 of them, violate this government guideline. In other words, 99.7% of the people following this government guideline very well. And this kind of good citizenship allow us to have a low instance and mortality, and also to acquire this adequate PPE are very important. For instance, Taiwan has increased our mask production from this 1.8 million in January to 21 million in May. However, we have also to assure that everyone in the country can purchase a mask at a very low price. And we use this name-based distribution system to help the people to get this mask at low price. And we also developed this mask map in the app for the people to identify which pharmacist have this pharmacy, have this mask available. I think this in the second phase of this COVID-19 containment, the rapid vaccination is very important, and rapid development of numerous vaccines is an achievement of scientific robustness, rigor, and cooperation through public-private partnership. A new platform has been developed to manufacture messenger RNA, adenovirus, and spike protein subunit vaccines. And more importantly, I think that emergency use authorization and immune bridging have been adopted by national regulatory agency to accelerate the spatial approval of the vaccine. And as you can see on this graph, that in the UK, once there's an increase in this vaccination coverage, the incidence rate of the COVID-19 decreased very significantly. And also the mortality rate also decreased accordingly. However, when there's a new Delta variant, then there's a surge of this incidence rate. However, the mortality rate remain not increased very much. So immunization indeed has a very good efficacy. And in order to vaccinating our way out of the pandemic, it is essential to enhance development, manufacturing, distribution, and acceptance of vaccine. Among all the changes facing the global COVID-19 vaccination effort, I think inequality, vaccine hesitancy, and immune escape variant are perhaps the biggest ones. The promotion of vaccine sharing and coverage, the interruption of misinformation dissemination are essential. Of course, monitoring our variant with increasing infectivity and immune escape capability is in urgent need. And as you can see here, the immunization rate in different countries vary a lot. Countries are in this, such as in Hong Kong and in India and South Africa are much lower than those European countries. And in Taiwan, the immunization rate was not high until June, and we have a very rapid increase of the immunization. Now the coverage around the 73%. I think there's just as mentioned by Pope Francis, that vaccination is an act of love. We have tried our best to promote this and the good coverage of this immunization. And just as said by Pope Francis, he said that thanks to God's grace and the work of many, we now have the vaccine to protect us from COVID-19. And vaccine bring hope to end the pandemic, but only if they are available to all and if we collaborate with each other. And I think it is very important for us to try our best to increase the vaccine coverage of this the entire world. And the lesson we learned from the COVID-19 pandemic include the understanding the cause and origin of SARS-CoV-2 and COVID-19 is important for the prevention of future emerging pandemic. A new insight from science and new experience with health policy action have been quickly accumulating. Research and development of diagnostic, antiviral, and vaccine have entered a steep learning curve during the pandemic. Optimal management of pandemic with public health, citizen information, and contact trace reduction approaches accompanied by health services must be prioritized. Health workers, medical professionals, and scientists must be equipped for making morally and ethically responsible decisions in pandemic. And I also consider that financial relief and economic revitalization are also very important. And I think that in this post-COVID era, we have to reform the entire world, and we have to promote the overall health of the humans, animals, as well as the entire environment. So with that, I would like to conclude my talk. And thank you very much for your attention.
Thank you.